Calvin has had mitochondrial disease his whole life, and for him, one big challenge for him is the anesthesia piece.
Calvin is a little guy that as soon as you meet him, you fall in love with him. He has a smile that reaches down deep into your heart. One of the problems in trying to treat Calvin is we don't know exactly why Calvin has the symptoms that he does.
Julie has mitochondrial disease. She's 14, almost 15, and the way that it affects her is really energy.
Some of the worst stuff is that I can't get out of bed. When I do get out of bed, I'm really dizzy, so I need help walking around. I usually kind of lay in bed all day with my computer.
One of the things that we're most excited about in our new strategic plan is our commitment to bring cures to kids faster. We really want to make sure that our kids have the access to the latest technologies, the latest treatments, and access to new clinical trials in ways that we've never been able to do before. We didn't do a clinical strategic plan, we didn't do a research strategic plan. We did a children's strategic plan, which said that we wanted to bring the best of our research and the best of our clinical care together in new ways. The work of the Mitochondrial Guild has been a perfect example of this. They have done amazing work in supporting the bench research that we can bring to kids at the bedside.
Everything we do in the lab is done with the idea that it's going to improve the lives of a patient. The ability to actually do it here, to actually take what we learn and walk over to the hospital and put it into practice is almost intoxicating as a physician.
The concept of bench to clinical treatment, Juliana is a prime example. We did genetic testing, we found that she has a particular gene mutation that interfaces with mitochondrial function. Based on that gene mutation, we could pigeonhole particular drugs to help her feel better, to help manage her headaches. And so overall, hopefully, we'll be able to alter her disease course, give her a fuller life.
My hopes and dreams for Julie are just that she can achieve whatever she wants to achieve, that mitochondrial disease won't hold her back.
I just want to help people the way that other people help me when I'm not feeling good. And that's kind of what I hope and dream in life, is to help other people.
Phil and I talk about all the patients that go under anesthesia. Before we started seeing Calvin, it was noted that after anesthesia for procedures, that he had a difficult time in waking up.
A simple tonsil and adenoid surgery resulted in a 19-day hospital stay where he just wouldn't wake up. We just recently had a pretty significant surgery that we had to do. We were terrified, absolutely terrified. And Dr. Morgan decided he was going to use that EEG cap.
The Guild has purchased for us, and we are using a portable EEG monitor. And by using an EEG, we can modify the delivery of the anesthetic.
And Dr. Morgan came into that, what we call the getting ready space for surgery. And Dr. Morgan literally just scooped him up and, helped put him on the OR table and held his hands and said to him, "You're not alone. I'm with you. You're safe." And he said that over and over and over again until Calvin was asleep. And as a parent, it's incredibly difficult to walk away from your child knowing all that history of how hard it's been. But I walked away knowing he was in Dr. Morgan's hands. I knew that Calvin would be okay. As we walked out of that hospital, out of Seattle Children's, Calvin looked at me and said, "Mommy, please thank Dr. Morgan for keeping his promise. Please thank him for me." And he said, "And take a picture of me walking out of the hospital to send to him." And I did exactly that. I took a picture of Cal with his feeding backpack on, walking out of the hospital straight from the ICU. And I texted it to Dr. Morgan and I said, "Calvin wants to thank you for keeping your promise."